Look, it's those that I've done, it's taking approximately 2 hours because you're putting together the survivorship care plan. Then I'm allowing about an hour to do the interview using telehealth with the patient involved. And look, that can vary, but I've found it's usually taking about an hour, probably. And then you have a teleconference with the GP that's involved in the patient's care. So that one takes approximately 30 minutes, and that involves discussing the goals that the patient may have set in their survivorship care plan and discussing those with the GP and looking at ways that we can help the patient reach those goals that they've set. So it might be liaising with either the GP or the practice nurse in terms of referring on to exercise physiologists or dietitians that they can access through the community through a chronic health management plan. On the actual survivorship care plan, obviously you'll have patient details, and then you'll also have their diagnosis, what their treatments have been. It'll also discuss the side effects that they may have experienced. It will include what referrals that we may have already done or accessed through the hospital, and it will then list the goals that the patient have set. And certainly one of them that often comes to mind is like a smoker often will use that as one of their goals to quit smoking. And then we sort of during that interview process, we'll discuss strategies of how they're going to achieve that, and obviously mention supportive services that are available out there for them, because we'd like to know that they're not on their own through this. They've got a team behind them. Yes, so the survivorship care plan, there will be a copy in the patient's file at the hospital. The GP will receive a copy, as well as the patient. I think starting your survivorship care plan early, pretty much starting it from diagnosis, is incredibly helpful, because it can be time consuming, and also you need to make sure that the information that you're putting on there is accurate. There might be information that you need to get from the other treating specialists that can take a little bit of time, but I haven't had any issues with that at present, and that's just, for example, patients that need bone mineral density tests, just liaising with the specialist and the GP as to who's taking that responsibility when they're due. Absolutely. If there's things that I may have put in there, I mean, it's a starting goal. The patient will develop different goals as they go along post their cancer treatment. So they'll be identifying, any other issues that may arise and helping them deal with that. So in that nurse-led clinic, we can use different media platforms, and I tend to liaise with the patient involved as to what's easiest for them. They can either come in for a face-to-face meeting, or we can use telehealth. I've used Zoom lately, which some of the ladies are very proud of the fact that they can use that form of communication. So I usually start that meeting off getting an understanding of what the patient actually understands of their actual diagnosis. And I'm finding from the beginning they sometimes can be a little bit vague in terms of the histology of their cancer. So I talk through that with them, allow time for them to ask me questions about that, clarify anything that they weren't sure on. And then we look at different treatments that they've had throughout their cancer treatment, whether that be their radiation, their chemotherapy. We go over side effects that they may have experienced. We talk through those. I give some hints and tips about how to deal with some of those. But it also, at that point, it may identify a concern that they might be having that I could raise with their specialist. So it's identifying things, I think, a lot earlier by taking this approach. And we also then look at modifiable lifestyle changes to reduce the risk of cancer reoccurring. And so we'll spend some time going through those, and it's difficult as a nurse because we're people that just want to fix everything, and often telling people, no, you need to do this, you need to do that. And I think in this process, you need to just take that step back, allow that patient to take ownership, because I think their goals will be more achievable by them taking that ownership. So, for example, patients that may be smoking, often that's one that comes up at times, and they're very keen to quit. They'll often say, I know I should, but have never really attempted to in the past. So it's directing them to supportive services such as the QUIT support program to help them through that. And then obviously this information is fed back to the GP, and the GP can also assist them with other supportive services. And we also provide the GPs with links to supportive services to help them as well. Information obviously is collated by me, but I also have the support of a research assistant throughout the process who set up those appointments with the GP. So they'll arrange a time that suits the GP and suits me, and we usually set aside about 30 minutes for those case conferences. The research assistant at present has been sending the care plan through once I've completed it after the interview with the patient, and we will then, during that interview process with the GP, we'll go through that survivorship care plan, and I'll discuss issues that may have arisen during that interview, or areas where the patients express where they'd like some further support, whether it be through quitting smoking or improving their exercise. And the GP then will help facilitate to ensure that the patients have access to those supportive services. And the GP also has me as a resource, so if they're concerned about anything, when the patient does come to them, they can liaise with me, and then I can liaise with the treating specialist team. Well, fortunately, throughout the process, we have a wonderful research assistant that has been helping with that process, and they've put together a checklist for us. So I generally will have that checklist present, and that just ensures that with each patient that we deal with, that we're continuing to provide the same information, and it has been incredibly helpful. I'm already seeing the benefits. I'm seeing patients being incredibly motivated and to improve their overall wellness, and accessing supportive services that they may not have wanted to access in the past, or felt like they didn't, but through the interview process between the specialist breast care nurse and the patient, those needs are identified.